An abscessed tooth is one of those dental issues that can quickly go from a mild discomfort to something more serious if left untreated. Simply, an abscessed tooth is a collection or pocket of pus inside the tooth or gums caused by a bacterial infection. This infection can occur at different parts of the tooth, but it's most common in the root area, which is the innermost part of the tooth containing blood vessels, nerves, and connective tissue. The formation of an abscess begins when bacteria enter the tooth, usually through a cavity, crack, or chip in the enamel. As these bacteria multiply, they cause inflammation and produce pus, which is a thick fluid made up of dead tissue, bacteria, and immune cells. This pus builds up in this area, leading to swelling and pressure, which is what often causes the sharp, throbbing pain associated with an abscess. When a tooth actually becomes abscessed, it's more than just a dental issue, it's a bacterial infection that can spread to other parts of the body if left untreated. Types of tooth abscesses. There are two main types of dental abscesses, periapical and periodontal. A periapical abscess is the most common type, and it occurs at the tip of the root, usually as a result of untreated tooth decay or injury. A periodontal abscess, on the other hand, affects the gums and supporting bone around the tooth, and it's typically caused by gum disease. Both types of abscesses are serious, and neither will go away on its own without treatment. Causes of tooth abscesses. An abscessed tooth usually starts with bacteria. When harmful bacteria enter the tooth through a cavity, crack, or injury, they can reach the soft inner pulp, which is where the infection begins. This can happen when you have untreated tooth decay, a cracked tooth, or any other damage that provides bacteria with easy access to the tooth's sensitive core. Once bacteria infect the pulp, your body's immune system responds, sending white blood cells to the area to fight the infection. The dead cells, bacteria, and tissue then accumulate in the form of pus, leading to the abscess. One of the most common causes of an abscessed tooth is poor oral hygiene. If you don't brush and floss regularly, plaque can build up on your teeth. This plaque contains bacteria that can erode your tooth's enamel and cause cavities. If left untreated, the cavity can deepen, eventually exposing the inner layers of the tooth and leading to infection. Gum disease, especially in its more advanced stages, is another leading cause of tooth abscesses. Gingivitis, for example, if not managed, it can evolve into periodontitis, which affects the deeper supporting structures of the teeth and allows bacteria to enter. In addition to poor oral hygiene, injuries to the tooth can cause an abscess. A cracked or chipped tooth can allow bacteria to bypass the outer layers of the tooth and infect the pulp. Another potential cause of an abscessed tooth is complications from dental procedures. Sometimes, a filling or crown that doesn't fully protect the tooth can leave gaps for bacteria to enter. Similarly, teeth grinding can wear down your teeth over time, increasing the chances of cracks or damage that lead to infection. Symptoms of tooth abscesses. The most common and noticeable symptom of an abscess is a persistent, throbbing pain in the affected tooth or gum. This pain can radiate to your jaw, neck, or ear, and it's often more intense when you lie down or put pressure on the tooth, such as when chewing. This pain often comes suddenly, and it gets worse over time. Many people with an abscessed tooth experience heightened sensitivity to hot and cold temperatures. Consuming hot or cold foods and beverages can trigger sharp, shooting pains. Swelling of the gum around the affected tooth is another telltale sign. This swelling may extend to the face and neck in severe cases, giving the appearance of a swollen cheek or jaw. Some individuals may notice a bitter taste in their mouth or experience bad breath that doesn't go away with brushing or mouthwash. This is due to the presence of bacteria and pus in the abscess. In advanced cases, a pimple-like bump may appear on the gum near the affected tooth. This bump, called a gum boil, may occasionally drain, releasing pus into the mouth and providing temporary pain relief. When this happens, you will notice a sudden bad taste in your mouth. In some cases, a fever may accompany an abscessed tooth. Your body is fighting the infection, and a fever indicates that your immune system is working overtime to combat the bacteria. Along with fever, you may experience fatigue or a general feeling of being unwell. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of tooth abscesses. To diagnose a tooth abscess, your doctor will perform a physical examination of your mouth, looking for signs of infection, such as redness, swelling, or drainage. In many cases, your dentist will tap on the affected tooth. If the tooth is infected, it will likely be very tender, and tapping on it will cause pain. This helps confirm the presence of an abscess. To get a more detailed view of what's happening inside your tooth, your dentist may take x-rays. An x-ray can reveal the extent of the infection and whether it has spread to nearby tissues, such as the jawbone. X-rays also help determine if the abscess is caused by an issue with the tooth's root or the surrounding gums. In some cases, your dentist may recommend additional tests, such as a CT scan, to determine the full extent of the infection, particularly if the abscess is deep or the swelling is severe. Treatment for tooth abscesses. Treating an abscessed tooth requires addressing both the infection and the underlying cause. One of the first steps in treating an abscess is draining the pus from the infected area. Your dentist will make a small incision in the gum or tooth to allow the pus to escape. While this procedure provides immediate relief, it's usually just the beginning of treatment, as the underlying cause of the infection still needs to be addressed. For a periapical abscess, the one at the tip of the root, a root canal is often recommended. During a root canal procedure, the dentist removes the infected pulp, cleans and shapes the root canals, and then fills and seals them. This eliminates the source of infection while preserving the natural tooth. After a root canal, a crown is often placed on the tooth to protect it and restore its function. In severe cases, or when a tooth is too damaged to save, extraction may be necessary. While dentists generally try to preserve natural teeth whenever possible, removing a severely infected tooth can sometimes be the best way to eliminate the infection and prevent its spread to other areas of the mouth or body. Alongside draining the abscess and treating the tooth, your dentist will likely prescribe a course of antibiotics. Antibiotics help kill the remaining bacteria and prevent the infection from spreading to other parts of the body. Common antibiotics used for dental abscesses include penicillin, amoxicillin, and metronidazole. It's essential to take the full course of antibiotics, even if the pain subsides before you finish the medication. In addition to dental procedures and antibiotics, your dentist may recommend pain relievers such as ibuprofen or acetaminophen to help manage the pain and reduce inflammation. For severe pain, your dentist may prescribe stronger pain medications. After treatment, you'll need to follow up with good oral hygiene practices and regular dental checkups to prevent future abscesses. Prevention of tooth abscesses. Preventing an abscessed tooth starts with good oral hygiene. This includes brushing teeth at least twice daily with fluoride toothpaste, flossing daily to remove food particles and plaque between teeth, and using an antiseptic mouthwash to reduce bacteria in the mouth. Regular dental checkups and professional cleanings are crucial for preventing abscessed teeth. Dentists can spot early signs of decay or damage and address them before they lead to more serious problems. It's generally recommended to have a dental checkup every 6 months. Finally, if you play sports or engage in activities where you might injure your teeth, wearing a mouthguard can help protect your teeth from damage that could lead to an infection. Now we want to hear from you. Have you ever experienced an abscessed tooth? What symptoms did you notice first, and how did you manage the pain before seeing a dentist? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.